How to improve your low libido or erectile dysfunction. One of the things that should cause us or give us more joy, more happiness as human being is sex. The other things, they are food, money, and other things. But when you have erectile dysfunction, instead of joy or happiness, sex gives you more stress. So let's do something about that. Hello, I am Dr. Kelly Dorr, and I am a family physician practicing here in Miami, Florida. What is erectile dysfunction? Erectile dysfunction, simply put, is whenever you cannot have or maintain a normal erection to complete the intercourse. What is that important? Boosting your libido and fixing your erectile dysfunction is very important because you will end up being happier and also make your partner happier. But in the way, you will also prevent some cardiovascular diseases like stroke, heart attack, peripheral vascular disease, since these diseases have the same cause as erectile dysfunction. It is important because sex is one of the things that make us happy. It is important because the men that suffer of erectile dysfunction or low libido report that it affects their life. You know about it, your partner know about it. Let's try to fix it. It is estimated that 40% of men in the US have some erectile dysfunction, and by age 70% of the male population will have some type of erectile dysfunction. That if you take these numbers, that I think are not accurate, because one of the last things that men want to talk about is the lack of libido or that they cannot perform in the bedroom, right? Take these numbers with a little grain of salt. There are lots of reasons why men can have some type of erectile dysfunction. And when you watch this video, you will understand why. So today we're gonna discuss the causes and the solutions that you can start practicing or executing today. How do you get an erection? For you to have an erection, a million things need to happen in your body. First, your brain, your spinal cord are involved. Your hormone, testosterone are involved. Your blood flow, your blood circulation are involved. And you need a partner. So for you to get an erection, all these parts needs to play the role, and at the end you will get an erection. So you can see how many places where things can go wrong, because there are a million of pieces that need to fit together for you to have a normal erection. Let's take your brain, for example. If you have Parkinson's disease, if you have a brain tumor, you can have erectile dysfunction. That's a given. But if you have a spinal injury, you can have erectile dysfunction. If you have a surgery in your spine, or even a surgery to treat some type of other disease, you might end up with erectile dysfunction or libido problem. Patient with prostate problem, or prostate cancer, patient with colon cancer, patient with rectal cancer can have surgeries, and one of the complications of these surgeries is erectile dysfunction. Other type of problems that can cause erectile dysfunction, diabetes kills your nerve and you end up with erectile dysfunction. Hyperthyroidism cause erectile dysfunction. A lot of medications can cause erectile dysfunction, and sometimes it's even over-the-counter medication. You don't even need a prescription to get this medication, and you can end up as a side effect having erectile dysfunction. Hypogonadism, which is a $10,000 word to say that your testes are producing less testosterone. You will feel fatigue, you will feel tired, you're losing muscle strength, you're losing your muscle mass, and also you will feel depressed, anemia, and you will have problem having your libido, you will have problem with your sex drive, you will have problem getting normal orgasm, and erectile dysfunction. Other problems, vascular disease, diabetes, hypertension, high cholesterol. People that smoke also have higher risk of having erectile dysfunction. So on the other side of the spectrum, you have the psychosocial issues that can cause you erectile dysfunction. People that constantly fighting with the partner abuse, people that have economic problem, or people that have some performance anxiety. They get some anxiety if they cannot perform, which causes them more anxiety and then make the problem worse. People that suffered some type of abuse, can be sexual or other type. People that have some fear of getting some STDs or some type of disease, or even people that have fear of God, that they are committing a sin, can cause you a mental block and cause you to have some type of erectile dysfunction. So what should you do? First, pay attention to the symptoms. Pay attention to what your body is telling you, what you're feeling, what's happening to you. Does the erectile dysfunction happen with one partner or with everybody you've been with? Do you have normal morning or evening erection? Do you have normal erection with masturbation? Or do you have a sudden loss of erection? Or is the problem gradual, coming down, you coming down? So all these things, you have to pay attention to these signs, because when you go see your doctor, he's gonna ask you all these questions. You have to open yourself and answer all these questions. Don't be ashamed, because let me tell you, if you had high blood pressure, if you had diabetes, if you had high cholesterol, if you had thyroid problem, you would not be ashamed to talk about it. And erectile dysfunction is a disease like any other. So open up, talk with your doctor, and explain to him all the symptoms that you have, so he can help you and do the test that he needs to do to help you. So some treatment that doctors use can be testosterone replacement if it's low, can be by cream, by gel, can be injection, or can be tablet. Men with psychosocial issues should try to fix this problem, because you will not have a normal erection if the cause is still there. What can you do right now at this moment to fix your erectile dysfunction or to try to improve it? If you are overweight, you are obese, try to lose some weight, because the more fat you have in your body, less testosterone you're gonna have. Less testosterone you have, lower will be your libido, and you are more at risk of erectile dysfunction. So let's get moving. The other thing you can do is to change your diet. You can start putting some more fruits in your diet, like grapes, but you have to eat the skin also. Drink some wine. It has to be the red wine. These things has a substance called resveratrol, which increase your testosterone level and help you having better erection. One thing with resveratrol is that if you take supplement of resveratrol, it will not get absorbed as well as the one you get from your food. So it's better to eat it than taking it in tablet. Other thing that you can do is watermelon. Watermelon will increase your nitric oxide, which will increase your blood circulation, making you having a better erection. Pumpkin seeds and garlic will decrease your cortisol level, making you less anxious, more relaxed, and increase your testosterone level for a better erection. Pomegranate also has been found to help people with erectile dysfunction. Salmon is rich in vitamin D, which help increase your testosterone, and also has omega-3, which help you having better blood circulation for a better erection. Chia seed and flaxseed have been found to boost libido and testosterone, because these foods contain essential fatty acids that are the building blocks for hormones like testosterone. Saffron is a natural aphrodisiac that is used to increase energy, libido, and boost your testosterone. Saffron has been found to boost testosterone level and libido, even on patients with side effects of some antidepressant medications. Goji berry will also increase your libido and boost your testosterone level. Celery contains androsterone, which is a male hormone that is known to give more vitality, energy, libido, and masculinity. Everybody have heard about Viagra, Cialis, sildenafil. We know about these drugs and we know how to use them. But I have a few advice for you. First, if you're gonna use one of these drugs, if you are taking some other nitrate medications, try not to combine them, because your blood pressure can drop. Second, if you're gonna take this medication, some of them you have to take 30 minutes, some of them you have to take 60 minutes before the sexual intercourse. And also avoid eating a lot of fatty food, because if you eat a lot of fatty food with this medication, you're gonna lose the benefit from them. From the list of causes of erectile dysfunction that I mentioned, you see that there is a million reasons why you can have low libido or erectile dysfunction. The easiest thing to do is to try to fix the low-hanging fruits or possible causes by seeing your physician and get some tests done and fix anything that is abnormal, like your thyroid, your testosterone level, your blood sugar, your blood pressure, your cholesterol level. So if you combine all these things, exercise, losing some weight, eat more fruits, watermelon, grapes, drink some red wine, salmon, vitamin D, pomegranate, for sure you will end up with a better erection and more libido. Give me a second. We'll be right back.